Welcome to Mentally Healthy. We're so glad you're here. We are very proud to welcome and introduce Innovative Products as the sponsor for today's video and content. IPP supports the ongoing mission of Mentally Healthy and our affiliations. As Innovative Products' tagline outlines, Mentally Healthy honors discovering the possibilities together.
Let's take a moment to relax and breathe. Today, we're going to learn and explore 5 myths about post-traumatic stress disorder, PTSD. We at Mentally Healthy are extremely sensitive to matters that may trigger an emotional response in our viewers and listeners. If you feel the subject matter contained in this video may be potentially upsetting or disturbing, please discontinue watching. While our videos are targeted to provide information for awareness and educational purposes, our viewers' mental health is important to us. With that in mind, let's continue. The misinformation about PTSD is not only wrong, but dangerous. Shell shock, or strain, combat fatigue, post-traumatic stress disorder, PTSD, has been called many things over the years, but what is it really? Is it an unfortunate affliction reserved for soldiers and war refugees? Is it a violent gremlin locked up inside each and every patient, ready to erupt at any moment? Does inner strength protect against PTSD? Is inner weakness a prerequisite? Although clinicians have been aware of the realities of PTSD since the 1980s, many people still hold unfounded beliefs about this disorder. Today's video will reveal and review 5 common myths associated with PTSD and why they're wrong. If you're ready, let's get started. Number 1. Only soldiers get PTSD. When most people think about PTSD, they picture hardened war veterans. While PTSD commonly affects veterans, with estimates showing that anywhere from 11 to 30% of soldiers will develop PTSD in their lifetime, anyone can actually develop the disorder. 8 million Americans cope with PTSD each year, many of whom have never served in the military. Women are more likely to develop PTSD than men, with a lifetime incidence of 1 in 10. Men, in contrast, have a lifetime incidence of 1 in 25. Women are more likely to develop PTSD due to sexual assault and child sexual abuse, whereas men are more likely to develop the disorder due to accidents, physical assault, natural disaster, and combat. Number 2. Experiencing trauma is enough to develop PTSD. Unfortunately, traumatic experiences are very common. According to the U.S. Department of Veterans Affairs, roughly 60% of men and 50% of women experience at least one trauma over the course of their lives. Traumatic events can include sexual assault, physical assault, accidents, child abuse, combat, natural disaster, or witnessing death or injury. Most people who experience trauma, however, do not develop PTSD. They may experience signs of acute stress after the incident, including insomnia, anxiety, and depression, but with time, these people tend to recover. Others, meanwhile, go on to experience severe symptoms that last for several months if not years, potentially earning a diagnosis of PTSD. Number 3. People with PTSD are weak. Since not everyone who experiences trauma develops PTSD, does this mean that the people who do develop PTSD are weaker than those who do not? PTSD, like any mental illness, is not a character flaw. Some individuals who develop PTSD may do so because of a genetic predisposition to the disorder, not unlike a genetic predisposition to heart disease. Others may develop PTSD because the trauma they experienced was particularly horrific, or because the traumatic experience lasted for a long time. Because PTSD is an actual, biological illness with real neurological consequences, no one can get better by simply trying harder to be healthy. Professional treatment is not an admission of defeat, but rather an essential step in treating a brain disease. Number 4. People with PTSD are dangerous. Most of us are familiar with the classic movie trope: a character with PTSD doesn't recognize that he's no longer at war and violently lashes out at the people around him. In reality, however, neither psychosis nor aggression is a hallmark symptom of PTSD. In fact, the main symptoms associated with PTSD include intrusive thoughts, nightmares, trouble concentrating, avoiding thoughts, feelings, locations, and people associated with the traumatic event, flashbacks, or the sensation that the event is happening again, hypervigilance, irritability, insomnia, guilt, inability to enjoy old hobbies, isolation, and low mood. Although some studies have found that people with PTSD are more inclined toward violence than the general population, these effects were eliminated once the researchers examined confounding factors such as substance misuse and co-occurring psychiatric disorders. Even without taking these factors into account, however, the vast majority of people with PTSD are nonviolent. In actuality, less than 8% of the PTSD community commits violent behavior. Number 5. PTSD cannot be treated. Mental illnesses like PTSD cannot be cured, but they can be treated. Researchers and clinicians have uncovered multiple treatment modalities that reduce the symptoms associated with PTSD, including cognitive behavioral therapy, prolonged exposure therapy, and eye movement desensitization therapy, or EMDR. Psychiatric medication like mood stabilizers can help if the person has an underlying cyclic mood disorder. Often, the most useful medications, such as prazosin, minipress, are those that calm the brain and the individual, and allow normal sleep without nightmares. It's completely possible to live a normal life while also coping with PTSD. You've probably met multiple people with PTSD over the course of your life, and never even realized it. This concludes our video on the 5 myths about post-traumatic stress disorder, PTSD. Since so few people recognize the realities associated with PTSD, individuals who struggle with the disorder often feel misunderstood, and for good reason. People with PTSD may resist telling their friends or loved ones about the diagnosis, for fear they'd be viewed as dangerous or unstable. They might resist treatment, erroneously believing that the best way to fight PTSD is to just be mentally strong. What other myths have you heard in connection with PTSD? Do you or someone you know show signs that you thought were PTSD but now, not so sure? The myths associated with PTSD build a stigma that prevents patients from getting help, making misinformation about this disorder not only wrong, but dangerous. It's vital that all of us understand how to separate the facts from the myths when it comes to mental illness. Please share with us your experiences in this area. If you or someone you know are experiencing symptoms of post-traumatic stress disorder, please know there is help. Finding a therapist who truly specializes in the treatment of the disorder and understands how to treat it effectively is an important next step. Your friends here at Mentally Healthy support the American Psychological Association for finding a good therapist and ensuring you work with a qualified professional who has background and expertise that will benefit you and your specific needs. We are not affiliated with that organization and receive no special compensation for recommending them. We just recognize the importance of finding qualified professionals to help us when help is needed. Another great resource is also available for those that can take advantage of it. For all our viewers that reside in the United States, a hotline is available to act as an immediate response lifeline center for all suicide and crisis events. Just call or text the number 988, local rates may apply, to immediately be placed in touch with someone you can talk to. If you are a U.S. veteran or military service member, you may text the U.S. Veterans Crisis Line directly at 838-255. Both of these resources will also be placed in the description area of this video. Use these trusted resources as needed.
Well, that's all for today. Thanks so much for joining us at Mentally Healthy. If you've enjoyed our video, please like it, and consider subscribing to our channel, as we have lots of great new content in store for you. Subscribing, liking, and clicking the notification bell keeps you connected to us, and truly helps our channel grow. Here's a few other great videos from our channel you can visit right now. Until next time, stay mentally healthy.